Mr. Henry, please, welcome.
For the record, my name is Chuck Henry. I am the administrator for the Florida Department of Health here in Sarasota and serve as your local health officer. It's a pleasure to be able to speak with you this morning and just provide a little information on, from a public health perspective, where we're at as a community and where the direction we're moving. In terms of where we're at, as is happening statewide, our overall numbers look pretty good. Things are trending down from what appeared to be a peak in mid-April across the state, and the same is true for Sarasota. It would be an understatement to say, as a public health official, I would rather see everything way down, completely gone, but I think we've got a journey ahead of us before we reach that point. I do want to, early on, just recognize the town of Longboat Key for your efforts during this public health emergency. As Mr. Harmer noted, you had some early cases on. In fact, this zip code area was one of our concern areas early on, but that was put under control pretty rapidly. And since mid-April, there's not really been any cases identified in the Longboat Key zip code area. And I think that's a credit to the seriousness with which both local officials and the residents of Longboat Key took in terms of following the guidelines, especially social distancing, washing hands, staying home when you're sick, doing all the things we need to do to protect our communities. So my compliments out to you there. When we look at what's next for us as a public health standpoint, we continue to monitor all the data very closely, trying to provide advice that we can as local governments work through this reopening and what it looks like for their particular community. As we look at data moving forward, that percent of positive cases becomes a really important number from my perspective. So I just want to share that with you, especially with the state emergency management testing site opening up this weekend out at the UTC Mall area. We expect the number of tests in our community to go up rapidly. In fact, I think I heard last night they did 400 yesterday and expect to do that plus every day moving forward. This will rapidly increase the number of people tested across our community. It could also increase the number of positive results we get back. Positive results won't alarm me so much as what is the percent positive. So we'll be watching that number really closely to monitor what's going on. And that's really an indication of the amount of virus present in our community that's circulating in the community. Typically, when you're unable to test a large number of individuals, you're only testing those that are sick enough to engage the health system. So your percent of positive individuals will be much higher than it truly would truly be if it reflected the entire community. So we look forward to that. In addition to the state testing, as Mr. Harmer noted, we are continuing from the health department to reach out into specific neighborhoods where individuals may not have had access to testing. Most concerned about those that may not be able to drive to testing sites and those that we know have underlying health risks. So we are trying to do that with what I'm calling pop-up events. We have a mobile bus that goes out to neighborhood parking lots. Those tests are by appointment only. Right now we're trying to test anybody that's currently ill and any healthcare worker. The healthcare worker connection has become an important aspect since so many of our elder care facilities have these workers in them, and since we've implemented rules of no visitors for quite a while now, as we see new infections popping up in our elder care facilities, they're almost always a result of a asymptomatic staff, meaning they don't know that they're ill, bringing the illness into the facility. To help us get a better handle on that, the governor has authorized regional strike teams. Ours works out of Fort Myers for our region, and these teams are now reaching out to our elder care facilities to offer testing to all of the staff, and if there are any ill residents that haven't been tested, they'll also test them. This will give us a good idea about illness in staff members and hopefully give us a better handle on what's happening with these vulnerable populations. As I think about what to look forward in terms of this reopening and specific advice for Longboat Key, I used the words at a recent county commission meeting: caution, moving slowly, and great care. And I think those same words apply in terms of thoughts. Most important, though, is continuing the great work that your community has been doing. This is not a time to stop paying attention to social distancing, staying home when we're sick, washing hands as often as possible, and wearing masks when we're out in public situations where we may not be able to control the distance between us and others, like grocery stores. So those masks are important because they protect others from each of us if we happen to be an asymptomatic carrier, and more so than they protect you. But they do become an important part of our strategy whenever citizens are participating in activities where they may not be able to completely keep that social distancing space. While the number of new cases and the percent positive are going down, and Longboat Key has done a great job in their work, the actual risk to residents really hasn't changed. So we've done a great job in controlling the transmission of the virus, but we still have a number of vulnerable residents throughout the community and county, including on Longboat Key. And so I'll remind you that vulnerable residents includes anybody over the age of 65, and in Sarasota County that is 37% of our population, especially if individuals have underlying health conditions. So that risk is still very real and there, and so it becomes critically important as we begin to think about moving back towards whatever the new normal looks like. It becomes important that we keep that in mind and continue to practice good public health measures. I did want to speak just for a minute about antibody testing. There's been a lot of questions about antibody testing. The testing is going on out at UTC Mall, and the testing that we typically do is referred to as molecular testing or swab testing. That involves swabbing either deeply into the nostrils or in the back of the throat. And what we're actually testing for there is actually looking for the RNA of virus. So it tells us it's a very good test for telling us who is currently shedding the virus and may be infectious to others. The other test that's talked about a lot is the antibody testing. It's actually a serology test or a blood test, and it's looking for the presence or absence of antibodies to this virus. That's going to become an important part of our testing strategy as we move forward. But it also comes with some unknown questions and pros and cons. It's not a real big help for public health in terms of identifying new cases because you don't typically develop antibodies until at earliest maybe the 4th or 5th day of illness, but for most people, days 7, 8, 9, or 10. So you've already passed your most infectious period in terms of danger to others by the time the antibody test would pick that up. So it's not the best test for identifying new cases. It could be important, though, in helping us determine the prevalence of illness in our community. So how many individuals did we have that may have been exposed and had mild cases or asymptomatic cases that have now recovered? And we would have no way of knowing without testing for antibodies. It also may be helpful if some of the new treatment methods that they're experimenting with that involve serum with antibodies. It would help identify individuals that could donate blood and provide that serum for patients. So there are a lot of positive things around antibody testing. And, of course, as vaccines are developed, the whole purpose of a vaccine is to stimulate that immune system memory of antibiotics and get the antibodies produced at a higher level to provide immunity. It is important to note, though, that at this point, science has not confirmed that immunity can be gained from having the illness. So just because there's antibodies present early on doesn't mean that there'll be immunity from the virus. So that still needs to be explored. So one of the concerns is that people have an antibody test, and it's positive, they assume they may have immunity, and that may not be true. The other big concern around antibody testing, there's a lot of different tests and methodologies. Most are not approved by the FDA yet, or they've been approved under the emergency use authorization. So they haven't undergone rigorous testing as we would normally do. So with some of the more rapid antibody tests, there's a question about, are they specific for COVID-19? Because there are other coronaviruses out there that have been around for a number of years, including some that are responsible for the common cold. So we want to make sure that a coronavirus antibody test used in this purpose was very specific for COVID-19. Also, some of the tests will tell you presence or absence of the antibody, but they won't quantify it for you. That requires a little bit more in-depth type of blood work. So it can actually go in exactly the same as when we do a titer for someone that wants to know if they have immunity to measles or whether they need to get a vaccine booster. So there's a specific number that should be attached in terms of quantity of antibodies associated with that. And of course, until we can determine whether or not immunity can even exist with COVID-19, we won't really be able to quantify those numbers. So we've been real cautious as a state about moving forward with antibody testing and distributing those. I think you've heard the governor speak. The state has moved forward with purchasing some antibody testing that has had pretty good results in the laboratory in terms of very few, actually zero false readings in their initial tests, although I'll caution that those were small. So they are moving forward with those particular antibody tests, and those will be distributed around the state to key locations probably within the next few weeks. And then we'll look at the results from those and make some decisions on how to move forward with antibody testing in a more robust way across the state. And the final thing I wanted to mention is contact tracing, because we get a lot of calls from citizens who are willing to volunteer and help us with contact tracing. I just want to talk about what an important piece of work that is and the work that we do day in, day out, and that is as we identify new cases through testing, being able to interview those cases and understand who they've been in contact with during the period of infectivity, and making sure that we reach out to those individuals and test them if they're ill, or isolate them until usually for 14 days beyond when they had contact with the case, so that we can ensure they're not, if they do get ill, they're not going to infect other people. This work is critical to all of our operations from a public health perspective as we begin to open back up our community and businesses. We want to be able to identify cases quickly and isolate those sick individuals and quarantine those that may have been in contact, so that we can prevent a resurgence of the disease over the next period of time as we begin to move functions back into the community. So far, we've been very fortunate in Sarasota. We have a really strong epidemiology department. We've been able to pull our school health nurses in to assist with that, as well as some CMS nurses, Children's Medical Service nurses. So we've had a pretty robust contract tracing program. We've looked at where staffing is and established thresholds as we move forward. If the volume of individuals being traced increases, we believe we can meet that demand internally until it about doubles our current effort. After that, we will have to look outside for additional assistance. And so we are taking information from individuals interested in helping. I don't know if we'll need them or not. I hope we won't. But I just wanted to assure you as a commission and the citizens that may be listening that we feel pretty comfortable that we have the staff needed to do that work right now and into the immediate future. We currently average about 200 to 250 individuals that we're monitoring on a daily or weekly basis that are contacts of other cases. And that's been our current caseload for a few weeks. And we think we could double that caseload before we need outside assistance. So I'll pause there and try to answer any questions you may have. And I just thank you for the opportunity to talk.
Well, Mr. Henry, thank you very much for all that you do for the people of Sarasota County. And thanks for taking the time to visit with us today and explain what's going on downtown. And we appreciate your efforts. Does anyone on the commission have any comments or questions for Mr. Henry?
I do have one question for him if he still has a little time for us. In the Sarasota Herald Tribune in the last week, there was a report that 3 Bradenton long-term care facilities and 1 in Sarasota had quite high rates of infection and death. And there was common ownership of those facilities with one owner. My question to Mr. Henry is, given that raises a question about management, are you at liberty to say to us what, if anything, is being done other than testing staff with respect to those facilities where there's a high rate of mortality and there seems to be a common owner?
Yes, I can comment on that. And first, I will tell you that the Agency for Healthcare Administration is the regulatory agency for our long-term care facilities. So this would, review from an administrative standpoint moves into their arena. But recognizing our role as Department of Health in testing and working with infection control, there's been a number of things put in place around the state. The governor has made available to us infection control specialist teams that we can call to come in and work with facilities, and we've utilized them in several of our facilities. They've also made available what I call augmentation teams, and these are teams that consist of a healthcare provider, nurses, other healthcare professionals that actually come in and work side by side with the facility to augment their staff, while at the same time observing everything going on, so that they can provide on-the-job training in the areas of infection control and appropriate PPE usage. And those have been extremely valuable in helping curb infections once they get started in these facilities. Some of them, it's an extreme challenge. These are what I call the most vulnerable of our vulnerable citizens, and they're in situations where staff and others move from room to room, and so it's really, really important once we have virus in a facility to go through a number of careful things to protect them. One of the things that we've discovered, and this is getting back to your question about the 3 facilities that the paper listed, one of the things we've discovered is that many workers in these facilities, and here in Sarasota County we have almost 16,000 workers that serve 130 facilities. Many of them work in multiple facilities. Many of them are part-time workers that hold multiple jobs. And so that's one of the reasons we're trying to aggressively test healthcare workers, because what we're discovering is either they bring it into the facility or they get it in one facility and bring it to another. And this is probably the case in facilities under one ownership where staff is shared between various facilities. So that is an area we're looking really hard at and trying to get a handle on it. Finally, I want to let you know that, just one more comment, that ACA has set up as their regulatory agency, basically a pipeline for us to put any concern that we have about management into them as a complaint that they'll respond to immediately, and they've been very responsive for us whenever we've done that. So.
Thank you.
Does anyone else have a question or comment for Mr. Henry? Yes, Commissioner Bishop.
Yeah.
Thank you. And Dr. Henry, thank you so much for being here for us today. This is probably more of your opinion as as we continue to see the numbers, especially in Manatee County, which have been growing significantly faster and at higher rates, and yet we see that they are opening their beaches today and doing other things that is reopening areas that will potentially have some impact on Longboat Key. I'm concerned, are these communities taking seriously the guidelines the CDC has been put forward regarding getting these facilities reopened?
Well, I believe that the majority of our citizens, whether they're in Sarasota or Manatee County, are taking serious those guidelines. Some of the decision points that are looked at, much of the community is in and out of grocery stores and other activities, which is not too much different than out exercising in the parks or on the beach, as long as people continue to respect that social distancing. And so that's our biggest concern as we move back on the beach. And I think in Sarasota, Mr. Harmer mentioned the beaches are open without restriction, but from my perspective, it's not without restriction. We're still encouraging groups of less than 10 and people to practice social distancing. And if that doesn't occur, then we might have to tighten things back up again. Unfortunately, with this virus, we're always 10 to 14 days behind, meaning what happens today in way of disease transmission, we may not see for 7, 8, 9, 10 days or maybe longer. So we're going to have to really keep an eye over the next 2 weeks on what's happening there. I see people moving around. Did you lose me?
Nope, you're still there.
Okay. So I do have concerns both for Manatee County and for Sarasota County as we move forward. This is new territory. There's no cookie-cutter blueprint that tells us exactly how to do this. I can tell you I'm in touch, probably not daily, but every other day with Dr. Bensey in Manatee County. We compare notes, we compare strategies, and we both do the best we can to ensure that our communities are educated and that we provide for them the best path forward in this current situation.
Dr. Henry,
I'm sorry. I was just going to say I'm really glad you asked that question, though, because, in the current situation for at least the last month, much of Longboat, I get a sense, has stayed on Longboat. And you have a grocery store and people have done what they're supposed to do. And as this begins to unwind, you will have others coming to the island that maybe not have been there. You will have residents venturing off the island, and the potential for risk increases. And so I can't stress enough how important it is to continue the practices that we've been doing while all this goes on. In fact, I think, early on, I don't have any hard evidence, but early on, it appears that the earlier cases in your zip code may have clustered around restaurant activities where people meet and talk and spend time close together. So I just ask that people continue to respect the distancing and the spacing of tables and be really careful as they move forward.
Just in follow-up, since you did mention our grocery stores, we are seeing, and especially as we've seen people from outside the area coming in, my personal experience is we are seeing fewer and fewer masks on people. Can you just talk as an education point for the community about the importance of masks? Again, you mentioned it in your comments earlier, but the number of people who say to me, I'm just not comfortable wearing a mask. And what I want to say to them is, I don't care how comfortable you are. I'd like to stay alive.
Yes, we certainly encourage individuals to wear masks when they're out in public. And the masks are really there to protect others from you in case you're an asymptomatic carrier. They do provide some bit of protection for yourself. Depending on the mask construction and the fit, most people estimate between 30 and 60% more protection than nothing. So that is some help. We are encouraging the cloth masks. They're available pretty widely to purchase or to make. The nice thing with those is they can be sewn, and you can create things that are comfortable for you, and you can wash them regularly. But they do become very important, and they should cover both your nose and your mouth when you're out in public, especially if you're in areas like grocery stores where you may not have complete control over staying distance from others. In my own personal experience, I think over the last 3 weekends, which is when I grocery shop for my family, I too saw fewer and fewer masks. But this past Saturday, when I was out, I was encouraged because it seemed like more people were wearing masks. And maybe that was just the stores I was in, but I was encouraged by that. But often when we're in grocery stores, you think you're social distance and you turn around and someone's right behind you. And so it just becomes important to wear a mask when you're in those public settings.
Thank you.
I see Commissioner Daly's hand raised. His virtual hand is raised.
Yes, Henry, just generally with respect to the percentage of fatalities per positive occurrence, what is that number and how is it trending, and how would you compare that to the flu occurrences?
Well, I didn't write down that percentage this morning, so I can certainly get that to you. But the trend has been a downward trend, so we're having less deaths per number of positives than we were earlier, and I think that's a direct reflection of early on you're testing only those sick enough to be in the hospital, and so your percentage is going to be higher. And as we test more and more in the community, that percentage will drop. It doesn't remove our risk, and while our numbers are pretty high in Sarasota, I think we're probably in the top 10 in the state. I don't know exactly where we're at. We've been as high as 5th in the state if you look at total number of deaths, as the newspaper likes to report. But when I look at it as percentage of population at risk, I have to remind others that Sarasota County has a higher population at risk, with 37% of our population over the age of 65. So we also have a higher number of elder care facilities in our community per population than many other communities. And so those are some factors that play into just the overall death rate. But we continue to watch those numbers very, very closely. And here in Sarasota, just like around the state, the majority of our illnesses are those over 65, and the majority of the poor negative outcomes and deaths are those over 65 with underlying health conditions.
So you said you could provide the numbers, and that's fine. But what's the ballpark percentage here for fatalities with respect to positive occurrences?
The report in the paper today was 6 per 100,000 in all of Florida. 6 per 100,000 population, not per positive test, but overall 6 fatalities per 100,000 people in this state. Same as California.
But I guess Mr. Henry, you would have what the percentage is of positive occurrences, I take it.
This is not a positive occurrence. It's a total population.
I understand that. That's what I was asking, just for the number with respect to positive occurrences.
Well, maybe Dr. Henry can get that information out to us, to Tom, and he can circulate it to the commission. That would be great. I see Commissioner Zunz has his virtual hand up.
Yes, with regard to the opening of the tennis courts, I think the procedure that we've adopted is appropriately conservative, and I imagine that will be expanded shortly. But I was wondering, they now have these thermometers that are readily available where they just touch it instantly to your neck or something and they get a reading. I was wondering if that might not be something that we might add, someone who wants to use a tennis court, if they would have to go through that very minimal procedure of assuring that they don't have a temperature.
Tom, do you know if that's in
Well,
the mix?
certainly checking temperatures. I'm sorry, I didn't mean to interrupt.
I thought that might be a question for Tom Harmer, whether that's in the mix for what we're talking about for the tennis center.
Yeah, we're still finalizing, and we'll announce that early this week. So I'll have more information for the commission on what the procedures will be. We have looked in the past about temperature testing, and I don't know any of the latest updates, and maybe Chuck can add to this. But when we looked at it before, you still have to be a little bit careful with HIPAA and the fact that it is some type of medical exam. But I know that there are employers doing it, and that we can do it under certain cases in certain scenarios.
And I see.
So there are a number of.
Go ahead, Chuck.
I just said there are a number of recommendations for employers in certain situations to screen their employees at the start of every shift, and that could include temperatures. The typical temperature that would be a screen out, you should stay home, would be 100.4 or higher. That can create challenges in outdoor athletic events where people are warm and heated already. So I'm not sure how effective that would be. From my perspective, I just continue to ask people if they're not feeling well, just to stay home and not risk exposing others.
Commissioner Dominic. Nothing? Okay.
No, nothing. Sorry, my hand. No.
I had two quick questions for you, Chuck, if you don't mind. They both involve testing. One has to do with the issue of rate of positives. I know that the information that we get regularly, the snapshots, deal primarily with number of new cases and totals and number of deaths and totals. I know the governor last Wednesday emphasized, and you alluded to it earlier in this conversation, that as the number of tests that are being done increases, maybe the more relevant issue is not the number of new cases, but the percentage of positives per test. And I just wanted to ask whether that kind of information could be more readily available and more constantly provided as more of a key tool than it has been to this point.
So the percent positive of all tests done in Sarasota County is available at floridahealth.gov on their COVID tab. You have to hunt for it a little bit. There's, I think, now 5 reports that you can click on under that website in addition to the big state dashboard. And one of those reports is it's a statewide report. And under that statewide report, they have a bar graph that tells you how many tests have been done in each county and what the overall percent positive is cumulative to this point. Ours today is right about 7%, just slightly under the statewide average. So that has been available for, I think, about 2 weeks now. They keep updating and upgrading that page, and that's a public-facing page. They've also implemented a county-specific tab that opens up and provides the day-by-day percent positive. They give you the number of negative tests, number of positive tests every day for the last 14 days. It's a nice graph. It's not as, from my perspective, as useful because the numbers kind of bounce up and down. There could be a day that very little testing was done, but we had a handful of positives, so it looks like a higher percent positive rate. And then we have a day where we do several hundred tests, and it may even be more positives than the day before, but it looks like a much lower. So I tend to look at it no less than a week at a time in terms of trying to understand where our positive rate is rather than a day-to-day. Although there's certainly things, if I see a really high daily rate, I might dig into the data to understand what happened that day and where the positives came from, just from a management perspective.
Got it. And the last question I wanted to ask was...
Want to circle back.
Go ahead.
Go ahead. I was just going to circle back. just doing the quick math, so it looks like our death rate in Sarasota County is about 9% of all cases, so it's higher than the statewide average, but I would expect that because we have a higher percentage of population at risk. And if you look at it percent of all the tests done to deaths, then it's a 0.9%, so just under 1%.
Yeah, the one other thing I wanted to ask, and I know that I think Tom has discussed this with you from time to time, is to look at Longboat Key as a possible place where there could be some intensive testing being done. We're a bit unique in that we're small and elderly and vulnerable and a bit self-contained as a barrier island. And as more tests become available, I think we may be a good test case, and it certainly would be useful for the people on the island if we could make Longboat Key as sort of a testing center and try to get a large number of the population out here to get it done if it were made available to us. So just a thought point. Understand
that, and I'm presuming you're talking about antibody testing at that point, and I have been conversing with Mr. Harmer on that particular point and encouraging patients. I'm kind of waiting to see how the test that the state has purchased pans through. I think they've purchased 300,000 of those, which sounds like a lot, but it's not really with 21 million in the state. But as we get some experience with those, that and the pricing, you can find antibody tests anywhere out there from $300 or $400 per person to the ability to buy some that are being shipped out of China for $5 a test. So the question is, what is the quality of each of those tests? And so we're trying to discern the best value for use across the state. And as soon as I have some assurance that we have a list of good products and good pricing, I'll certainly will share that with Mr. Harmer.
Perfect. Thanks very much. Are there any other questions? I see none. Chuck, thank you again for spending your time with us today. It was very, very helpful. And again, we appreciate what you're doing for the people of the county.
Well, thank you for the opportunity to be here, and I'll be signing off. Thank you.
Our pleasure. Thanks much.